What makes a neighborhood healthy? Access to doctors? High property values? Residents with a good BMI? Nature isn't always on the list, but it should be. Green space should be a part of every conversation about healthy cities. The Green Heart Project will prove that trees and green spaces are as important to a city's infrastructure as bridges and roads. Green Heart will study the relationship between urban green spaces and human health. It is the first study to rigorously assess the impact of greenness on the health and well-being of urban communities. Our hypothesis is that increasing the green space in the neighborhood can reduce air pollution, decrease the risk of obesity, diabetes, and heart disease, reduces mental stress, and increase the sense of community.
So we've increasingly come to realize that the environment has a very strong impact on human health. Especially the area that I work in, which is cardiovascular health and cardiometabolic disease. So about 70% or 80% of heart disease and about 70% of diabetes is in principle environmental, which means that it is preventable. And we've tried the best we can to discover new drugs, therapies, procedures to be able to contain the spread of heart disease, but still continues to be the leading killer, not only in this country, but everywhere in the world now. So there is increasing urgency in trying to develop preventive strategies that would diminish the impact of heart disease. And we think that exposure to air pollution, a lack of activity and exercise, lack of access to healthy foods are the 3 or 4 most common reasons contributing to heart disease. And so that's where the study is so critical, that this will be the first attempt to really understand that is this a viable therapy? Is it a viable preventive strategy that we could employ or deploy in other parts of the world? So we want to create this as a model that could be transported to other parts of the world to be able to mitigate or attenuate the extent of the disease burden due to heart disease and diabetes in different communities, because we're quickly running out of ideas.
The Green Heart Project is a 5-year study. First, we will measure the current air quality and recruit 500 people for the health study in a South Louisville neighborhood. We'll measure blood pressure and cholesterol levels, as well as stress, social cohesion, and overall risk for heart disease. When we have these baseline measures in place, we'll plant 8,000 mature trees. We will create an ecosystem designed to remove air pollution. We will compare the changes observed in the target neighborhood with a control neighborhood of 12,000 residents with no planned change in green space. We have tested our theory on a small scale at a local elementary school. Our Green for Good work will guide the Green Heart study design.
We need to realize that we are a part of nature and sort of inextricable part of nature. We cannot separate it out. B, we're always going to affect nature. There is no way that we can stop doing that. It's not feasible to say, oh, let's just stop messing around with the planet, let nature do its course. That's not going to happen. We need to develop evidence-based, reasoned ways of interacting with nature, and that's just what this project is about: is interacting with nature in a reasoned, evidence-based manner that we can learn from our level and type of interaction is what we should be doing in our relationship to nature.
The findings of the study could reveal a new link between nature and health.
So we're not starting from where we didn't know anything about trees, but I think we know a lot, but now this is the next step that we need to develop in trying to understand the exact impact and to quantify it.
At the end of our work, we will have an evidence-based blueprint for building neighborhoods that support healthy humans. We will understand exactly how to green urban spaces to reduce air pollution and promote the health and well-being of people living in cities. Our findings will shape new policies, guidelines, and building codes and encourage the development of healthy cities. We will create a new model of healthy urban living that could be duplicated in cities around the world.
So our key partners are the Institute of Healthy Air, Water and Soil, and we've been working with them, and actually the whole idea originated in partnership with them, that we are going to develop this project in trying to understand the effects of the environment on human health. And the Institute has been operational for about 2 years, and I've been associated with them for 2 years. And then within the Institute, we have been deeply concerned about a community's environment and how it impacts their sort of mental, physical, spiritual health. And so this seems to be a natural outgrowth of that collective concern in the part of the Institute, but also as part of an academic program. And I've been working on the effects of air pollution for many years, almost 25, 30 years and how the environment impacts heart disease. And so this is in the best possible way a combination of my academic research as well as a social responsibility. So I couldn't be more thrilled in doing this.